Hello, and thank you so much for joining us today. I'm Anita Reynolds, Manager of Grassroots Advocacy and Community Partnerships at National Patient Advocate Foundation. We're hosting this webinar because understanding Medicaid is the first step to protecting it, especially now as potential budget cuts threaten a program that supports millions. When we understand how Medicaid works, who it serves, and what's at stake, we become stronger, more effective advocates within our communities. Let's take a moment to recognize the sheer scale of Medicaid's impact. Right now, nearly 80 million adults and children rely on Medicaid for their health coverage. That's 80 million people depending on Medicaid to access essential healthcare services, everything from routine doctor visits to emergency care and all the needs in between. Given the critical role Medicaid plays, we simply cannot afford any cuts. Any reduction in funding or access would devastate millions of individuals and families who already face major barriers to healthcare. Our goal today is to understand just how crucial this program is and why it's so important that we advocate for its protection. As we continue, remember this number. 80 million people are depending on us to ensure Medicaid stays intact and fully accessible. 80 million people are depending on us to ensure Medicaid stays intact and fully accessible. Today, we'll focus on three key areas. First, we'll explain how Medicaid works and who it helps and what it covers. Next, we'll explore Medicaid's role in making healthcare work for all of us. And finally, we'll wrap up by sharing 3 actions you can take to help protect Medicaid. Now let's take a closer look at what Medicaid is. Medicaid is the largest source of health coverage in the United States, helping those who might not have any other way to get the care they need. It offers a full range of comprehensive care, from basic checkups to long-term care. The federal and state governments jointly fund Medicaid, and the federal government sets basic rules and guidelines. But each state manages and administers a program and has the ability to tailor it to their community needs. This balance allows for both national consistency and local flexibility. While Medicaid is a cornerstone of the safety net, there are other federal safety net insurance programs designed to help individuals access the health care they need. There's also Medicare, which provides health care coverage for individuals aged 65 and older, or for people with certain disabilities regardless of their income. Then we have CHIP, the Children's Health Insurance Program. CHIP provides affordable coverage for children and families who make too much to qualify for Medicaid but still can't afford private insurance. And then there's the Health Insurance Premium Assistance, which provides financial help to eligible individuals who need assistance covering the cost of health insurance premiums through the healthcare marketplace. Together, these programs, along with Medicaid, make up an important safety net, providing health care coverage across different age groups and income levels. Now let's dive into who Medicaid covers. But first, let's clear up a common myth. The first myth is that Medicaid is only for poor people. The truth is, Medicaid is available to a much broader group of people than many realize. Yes, it's income-based, but that doesn't mean it's just for people who are unemployed. In fact, many people who qualify for Medicaid are employed, sometimes full-time, but that still can't afford the high cost of health insurance, even if their employer offers coverage. Medicaid actually helps a wide range of people. That includes pregnant women, children, older adults, and people with disabilities, and even their caretakers. So as you can see, Medicaid is a lot more inclusive than many realize. It's a broad program that's designed to ensure people from all walks of life have access to the care they need. This chart shows the breakdown of Medicaid enrollment by groups. Children make up the largest share, highlighting Medicaid's role in covering low-income families. Adults, including those covered under the expansion, follow next, and people with disabilities and seniors make up smaller portions, but they often require more complex care. Now, why does Medicaid matter? Medicaid covers nearly 40% of all children in the United States, including many with complex medical needs. Let's take a closer look at one family's journey. Meet Adrian. At just 6 months old, Adrian survived non-accidental trauma, also known as shaken baby syndrome. He now depends on a trach and a feeding tube to survive. His mother serves in the United States Air Force. His father, Marcus, had to leave his job to become Adrian's full-time caretaker, dedicated to managing his daily medical needs and care at home. Adrian also has an older brother, Roman, who stands by him with love. Many people assume that military insurance like TRICARE covers everything, but it doesn't. Essential therapies, home nursing, and specialized medical equipment are often not included. That's where Medicaid comes in, filling the gaps to ensure Adrian receives the care he needs to heal and grow, while helping to support his entire family. For families like Adrian's, Medicaid isn't just a safety net, it's a lifeline. Let's clear up another common myth we often hear. Myth is Medicaid is a lesser form of health insurance coverage. That simply isn't true. Medicaid covers a wide range of services, often more than private insurance, especially when it comes to long-term care, home and community-based services, and supports for people with disabilities, children with complex medical needs. And instead of thinking Medicaid as a lesser than, we should recognize it for what it really is, a critical, comprehensive insurance coverage for millions of people. Now we'll go over what Medicaid has to cover. Medicaid provides comprehensive healthcare coverage and long-term care. All states are required to provide the same core benefits, including doctor visits, hospital stays, preventative care, and even transportation. Medicaid is a full-spectrum safety net designed to ensure people have access to the care they need to stay healthy. There's also a list of optional benefits that states can choose to include. These benefits include services like dental care, vision, physical therapy, and more. So depending on where you live, Medicaid coverage might include more or fewer of these optional benefits. This is why it's important to know what's available in your state and to advocate for the services your community needs. Here's another common myth. Medicare covers long-term care. In reality, Medicare does not cover most long-term care needs. It may cover short-term stays at a skilled nursing facility after a hospital stay, or some home health care under specific conditions, but it does not pay for ongoing help with daily activities like bathing, dressing, or long-term care nursing home care. When we talk about Medicaid's role, it's important to recognize just how critical it is for certain populations. In fact, 5 out of every 8 nursing home residents depend on Medicaid for their care. And when it comes to long-term care overall, Medicaid covers 61% of the total spending in the United States. That makes it the largest payer of long-term care services in the country. Now let's meet Miss Debbie. After retiring, Miss Debbie's health began to decline, making it unsafe for her to live independently. She had to move into a skilled nursing facility to get care that she needed. Without Medicaid, Miss Debbie and her daughter Tracy wouldn't have been able to afford the level of support she needed that allows her to live safely and with dignity. For older adults like Miss Debbie, who qualify for both Medicare and Medicaid, are known as being dually eligible. Medicaid helps cover critical services that Medicare alone doesn't provide. Many people don't even realize they have Medicaid because it's under a different name in many different states. For example, in California, it's called Medi-Cal. In Tennessee, it's known as TennCare. These different names can sometimes cause confusion, especially when people move across state lines or try to help family members in another state and navigate the system. You can also see here that even Children's Health Insurance Programs, or CHIP, may have a different name from its own Medicaid program. This is a good reminder of the flexibility states have in managing their own programs and why it's important to understand how Medicaid works in your state. Now let's talk about why Medicaid expansion matters. Let's look into Medicaid expansion and break down how Medicaid is funded. When the Affordable Care Act gave states the option to expand Medicaid, it opened the door for millions of low-income adults, especially those without children or disabilities, to finally gain access to the health care they needed. Traditionally, Medicaid is funded in partnership between the federal government and the states, with costs shared at a minimum of 50-50% split. However, states with a lower per capita income receives a higher federal match. That means the federal government pays an even larger share in those states. Now, when it comes to Medicaid expansion, the federal government covers 90% of the cost, making it easier for states to provide coverage to more people, especially those low-income adults who weren't eligible before. But the challenge is that not all states chose to expand. As of today, all but 10 states have expanded Medicaid. That means there are still people who fall into what's known as the coverage gap. These are the individuals who earn too much to qualify for traditional Medicaid, but not enough to afford private health insurance or qualify to the marketplace subsidies. Why do we care? The core of NPAF's mission is to make healthcare work for all of us. Medicaid matters because it's not just a government program, it's a lifeline. It ensures people can access the care they need and help level the playing field in a system that hasn't always been fair. Let's shift our focus to how we can all take action today. Now it's time to connect with your community because real change starts with conversations. Take everything you've learned today and use it to spark discussions. Whether it's around a dinner table, at community meetings, or even texting a friend, those conversations matter. Help others understand how Medicaid works, who it covers, and how it impacts our communities. Remember, every conversation is a step towards creating more awareness and making a bigger impact. Another way to stay connected and support this movement is by following us on LinkedIn, Blue Sky, Instagram, and Facebook. And if you haven't already, visit our website and sign up for updates. Invite your friends, family, coworkers, and neighbors to join in too. Every person who follows, shares, or learns more helps grow a community of advocates. And if you find one of our resources helpful, share it. Whether it's a social post, a fact sheet, or a webinar like this one, your share helps us reach more people and strengthen our collective voice. One of the most powerful ways we can advocate for change is by sharing our voices and stories, because when we speak up, change listens. Real experiences show what Medicaid means in people's everyday lives, how it helps families stay healthy, how it supports caregivers, and how it makes a difference when people need it most. So we're asking you to speak up and share your story. Let us know how Medicaid has made a difference for you, your family, or someone in your community. And don't stop there. Encourage others to share too. Your friends, your neighbors, your colleagues, anyone who has a story to tell. The more voices we lift up, the stronger our message becomes. We've made it easy. You can scan the QR code you see on your screen. It takes just a few minutes, but your story could help shape policy, guide change, and show what real people need from a healthcare system to work for all of us. In our final myth, many people believe that they can't make a difference when it comes to issues like Medicaid, but that's simply not true at all. Every voice matters, especially when it comes to advocating for something as important as healthcare access. Advocacy doesn't have to be loud or large scale. It often starts with something simple, a conversation about why Medicaid matters. Each of these simple, small actions add up, and that's what fuels the growth of grassroots movements. We've talked about the power of sharing stories, and now we want to show you what that action looks like. These are real stories from NPAF volunteer advocates who have stepped up during our last call to action and share how Medicaid has impacted their lives and communities. Every voice matters, and we took those stories and shared them directly with policymakers. When decision makers hear directly from the real people affected by their decision, it truly matters. It helps them see the human side of the issues and focus on real solutions. So as you read these stories, think about the ripple effect. One voice can bring awareness, grow understanding, and even lead to big changes. Thank you again for joining us today. By taking the time to learn about Medicaid, how it works, who it serves, and what's at risk, you're helping build a stronger, more informed advocacy movement. Your voice matters, and together we can protect and strengthen this vital program. Here's how you can make a difference. Tell your Medicaid story. Help decision makers understand how Medicaid impacts real lives. Your experience can make a difference. Encourage others to speak up. Invite a friend, family member, or community member who relies on Medicaid to share their story too. And spread the word. Post a link or QR code on social media, text it to your group chat, or share it in your community to help lift up more voices. Thank you.